The terrible triad shoulder dislocation is a serious injury that involves the following three components. 1. Anterior shoulder dislocation. 2. Rotator cuff tear. 3. Axillary nerve or brachial plexus injury. Anterior shoulder dislocation. This is when the humerus, upper arm bone, is displaced out of the glenoid fossa, socket, of the shoulder. Rotator cuff tear. This is a tear of the shoulder tendons that surround the joint and help to keep stable. Axillary nerve or brachial plexus injury. This is an injury to the nerves that supply sensation and movement of the shoulder and arm. The terrible triad shoulder dislocation is most commonly caused by a fall onto an outstretched arm in an aged person. Symptoms of the terrible triad shoulder dislocation include pain in the shoulder, swelling in the shoulder, loss of range of motion in the shoulder, numbness or tingling in the arm, weakness or paralysis of shoulder movement. Treatment for the terrible triad shoulder dislocation typically involves surgery. The goal of surgery is to reduce the dislocation, repair the rotator cuff tear. The prognosis for the terrible triad shoulder dislocation is generally good.